Have you ever wondered how chemotherapy and immunotherapy work in treating cancer? Both these methods have a common goal to halt the progression of this devastating disease, but they achieve this in very different ways. Chemotherapy, a well-known treatment, relies on powerful drugs that target and destroy rapidly dividing cells, a characteristic often seen in cancer cells. On the other hand, immunotherapy is a newer approach that boosts the body's natural defenses, the immune system, to better identify and eliminate cancer cells. While they share the same battlefield, these therapies follow different strategies. Chemotherapy is akin to a broad-spectrum bombardment, attacking all rapidly dividing cells, whereas immunotherapy is more of a sniper, enhancing the immune system's ability to specifically recognize and destroy cancer cells. Each therapy has its unique set of side effects and methods of administration, and the choice depends on various factors. Now let's delve deeper into the mechanisms behind these treatments. First, we take a look at chemotherapy, a widely known cancer treatment. Chemotherapy functions by utilizing drugs that directly target and eliminate rapidly dividing cells, which of course includes those pesky cancer cells. These drugs achieve their mission by inhibiting the ability of cancer cells to replicate themselves. Chemotherapy drugs can be received in a couple of ways, either through infusion or in pill form. The goal of these drugs is to attack all rapidly dividing cells in the body, not just the cancer cells. However, there's a downside. Chemotherapy can also damage healthy cells, which leads to side effects. These might include fatigue, hair loss, infections, nausea, anemia, and even changes in appetite. Nevertheless, chemotherapy is highly effective. It reduces the number of cancer cells, shrinks tumors, prevents the spread of cancer, and reduces symptoms. So while chemotherapy is a potent weapon against cancer, it's not without its drawbacks. Next, we will explore immunotherapy, a newer approach to battling cancer. Unlike chemotherapy, which attacks all rapidly dividing cells, immunotherapy specifically targets cancer cells. It enhances our immune system's ability to recognize and destroy these harmful invaders. This is particularly beneficial for cancers that have developed sneaky ways to evade detection by our immune defenses. Immunotherapy can be administered in several ways, from an IV infusion to tablets, topical creams, or even catheters into specific areas like the bladder. The method chosen largely depends on the type of treatment needed. As for side effects, immunotherapy can cause symptoms related to an increased immune response against cancer cells. These may include fever, weakness, muscle aches, fatigue, and breathing issues. Despite these potential side effects, the effectiveness of immunotherapy is noteworthy. It aims to boost the immune system's ability to target and eliminate cancer cells. Immunotherapy's targeted approach offers a different, potentially less harsh route to fighting cancer. Now that we understand the basics of chemotherapy and immunotherapy, let's compare them. When it comes to target cells, chemotherapy operates like a sledgehammer, attacking all rapidly dividing cells, including cancerous ones. This broad assault, however, can damage healthy cells, leading to side effects like fatigue, hair loss, and changes in appetite. On the flip side, immunotherapy is like a sniper, focusing on enhancing the immune system's ability to recognize and destroy cancer cells. This targeted approach can lead to side effects related to an increased immune response, including fever, muscle aches, and fatigue. The mechanisms of these two treatments also differ significantly. Chemotherapy inhibits cancer cell replication directly, halting their ability to multiply and spread. Immunotherapy, however, works indirectly by boosting the immune system's ability to detect and destroy cancer cells. Administration methods vary too. Chemotherapy is typically delivered through infusion or orally, a more general approach that aligns with its broad target mechanism. Immunotherapy can be administered through various routes, including IV infusion, tablets, topical creams, or catheters into specific areas, reflecting its more targeted approach. In essence, chemotherapy and immunotherapy are two sides of the same coin, each with their unique advantages and challenges. They represent different strategies in the fight against cancer, each bringing valuable tools to the table. The choice between them depends on a variety of factors, including the type of cancer, its stage, and the patient's individual characteristics. As we can see, both treatments have their unique advantages and challenges. In conclusion, chemotherapy and immunotherapy are two distinct but powerful tools in cancer treatment. Chemotherapy targets all rapidly dividing cells, while immunotherapy boosts the immune system's ability to specifically recognize and destroy cancer cells. Each has its unique side effects, with chemotherapy affecting healthy cells and immunotherapy causing increased immune responses. The administration methods also vary. The choice between these treatments is influenced by the cancer type, its stage, and individual patient characteristics. While the battle against cancer continues, these therapies offer hope for many patients around the